Chapter 26, Therapeutic Agents for Eyes, Ears, Nose, and Throat. We'll skip past the terms and definitions for now, but we will go over them throughout the chapter. We have the select common drugs used for conditions of the eye, ear, nose, and throat. So you can go through these and look at the different classes and practice pronunciating the generic names. The eyes are important sensory organs that perceive images and translate them into nerve impulses, providing visual input. The three different levels of healthcare personnel who work in eye care are opticians, optometrists, and ophthalmologists. Opticians make lenses to compensate for vision loss, but they cannot prescribe medication. Optometrists perform eye examinations and may prescribe certain eye medications. Ophthalmologists are doctors who treat major conditions affecting the eye and perform surgery. The eye has structures that work in unison to protect it, maintain its shape, and facilitate vision. The eye sits in a bony socket called the orbit. The eyelid covers the eyes and has 4 individual layers: the outer skin, the muscle, the connective tissue, and the conjunctiva. The muscles and fibers of connective tissues are under the skin in the lid. They allow the eyelid to open and close. The conjunctiva is a thin, transparent mucous membrane covering the anterior eye, the eyelids, and the sclera. The natural blinking reaction protects the eyes from foreign objects and allows lacrimal fluid, which is tears, to cleanse the eye. The lacrimal gland, which secretes tears into the eye, has ducts that lead into the nasal cavity. Tears contain antimicrobial enzymes to protect the eye from infection. And figure 26.1 is just the anatomy of the eye. You can see the conjunctiva, the sclera, the optic nerve. The cornea is a bulging transparent cover that allows light into the eye for visual acuity. It contains connective tissue and a thin epithelium coating. The aqueous humor is in the anterior part of the eye, between the cornea and lens. Many corneal nerve fibers sense pain. The sclera attaches to the cornea but wraps around to the back of the eyeball. The optic nerve extends from the back of the eye through the sclera. It sends images from the eye to the brain for interpretation. From the front of the eye, the sclera joins with the iris and the ciliary body. The iris is responsible for eye color and it filters light. The largest eye space is the posterior cavity, which the lens, ciliary body, and the retina surround. The ciliary body forms a ring around the eye's front. It holds the lens in place and regulates its shape to help focus vision. The area between the lens and the retina contains vitreous humor, a jelly-like substance that helps hold the eye's shape. The retina has layers of neurons, nerves, pigmented epithelium, and membranous tissues. Retinal receptor cells, known as photoreceptors, carry responsibility for vision, and the neuron carries signals to the brain. Figure 26.2 is just a cross-section view of the eye. 26.3 is eye muscles and their direction of movement. When focusing on distant figures or in darkness, the pupil dilates, allowing more light in. When exposed to excessive light, the pupil constricts, which is miosis, and the dilation is mydriasis. Aqueous humor is the watery fluid that maintains the shape of the anterior eye. It nourishes anterior compartment structures as well. As the body continually synthesizes aqueous humor, it must release it to maintain proper pressure in the anterior eye chamber. Excess aqueous humor drains through small ducts, the canals of Schlemm, near the sclera and cornea. So when we cry, the parasympathetic nervous system activates lacrimal glands directly. Many conditions affect eyes. Depending on cause, treatment can range from medication to surgery. The past decades have seen many development in corrective lens treatment. For myopia, nearsightedness, laser surgery is a popular alternative to eyeglasses. Many ophthalmic medications are available by prescription, and keeping eye solutions sterile is imperative because foreign objects instilled in the eyes can cause damage or infections. It says the pharmacist should instruct patients in the proper eye drop administration technique. And 26.1 is the general basic steps for administering eye drops and ointments. Table 26.1 has select non-anti-infective products for the treatment of the eye. Allergic conjunctivitis is a common condition. Irritants or foreign objects can cause mast cells to release histamine, which causes inflammation to fight allergens. When exposed to allergens, eyes become itchy, red, and watery, most often during allergy season. 26.2 lists select ophthalmic decongestants, antihistamines, and mast cell stabilizers. So these are all eye drops for allergic eye. So the medication Emmeline is indicated for allergic conjunctivitis, and that is an eye drop. We have alomide, which is used for conjunctivitis, vernal keratitis, and vernal keratoconjunctivitis. Corticosteroids relieve inflammation from infections, allergies, or injuries. Doctors often prescribe them post-operatively for inflammation. Avoid using the agents longer than necessary because they can compromise the immune system. Corticosteroid ophthalmic dosage forms include solutions, suspensions, and ointments. Side effects can include temporary burning sensation, blurred vision, eye pain, or headaches. Most anti-inflammatory agents are solutions or suspensions. Suspensions should be shaken well before use. So we have Pred Forte, Omnipred, and Pred Mile, which are all prednisolone and eye drops. Flurbiprofen is for meiosis inhibition and post-operative ocular inflammation. Ketorolac is used for allergic conjunctivitis, ocular pain, ocular pruritus, and post-operative ocular inflammation. Many pathogens, including bacteria, viruses, and fungi, can cause ophthalmic infections. Table 26.3 lists select anti-infective agents for the treatment of eye infections. So we have all the different classes: aminoglycoside antibiotics, fluoroquinolone antibiotics, all of which these are all eye drops. Macrolide antibiotics. We have erythromycin, which I have highlighted. This is an ointment. It's very popular for styes and other infections. You apply a 1 centimeter ribbon into your eye about up to 6 times daily. Natamycin is an antifungal. We use 1 drop in the conjunctival sac every 1 to 2 hours. Viruses, bacteria, fungi, or allergies can cause conjunctivitis and acute conjunctival inflammation, which is pink eye. The eye becomes red and yellow discharge crust over the eyelids or eyelashes, often after sleep. The eyes may burn and itch, causing blurred vision. Newborns can acquire a neonatal conjunctivitis form as they pass through the birth canal. Immediate prophylaxis is crucial, or the infant might lose his or her eyesight. So we have some more bacterial antibiotics. So tobramycin, again, erythromycin. The 3 most common viral eye infections are herpes simplex, keratitis, and viral conjunctivitis. Many eye viruses occur more frequently in immunocompromised patients, such as patients with HIV. Fungal conjunctivitis is rare. The primary ophthalmic agent for superficial fungal eye infections is natamycin, a fungicidal agent. And that's one I just talked about up here. And again here, natamycin, it's indicated for blepharitis, fungal conjunctivitis, and fungal keratitis. Glaucoma represents an ophthalmic disorder group characterized by high intraocular pressure. Untreated glaucoma can lead to peripheral vision loss and blindness. Primary glaucoma has two subtypes, open angle and closed angle glaucoma. Open angle glaucoma has a progressive slow IOP increase. In this glaucoma form, the angle of the eye's anterior chamber through which aqueous humor is reabsorbed is open. In contrast, closed angle glaucoma has a visual angle obstruction produced by the iris during contraction. Closed angle glaucoma often presents suddenly with intraocular pain, loss of vision, and redness of the eye. So in table 26.4, it lists the select agents for the treatment of glaucoma. I have highlighted Zalatan, latanoprost. It is usually given 1 drop in the affected eye every night. It's a very common medication that's kept in the refrigerator for glaucoma. Beta adrenergic blockers, which are beta blockers, lower IOP in open angle glaucoma. By blocking beta receptors, these agents prevent the activation of the beta adrenergic response, which affects many body systems. So we have Batopic for open angle glaucoma. We have Cartilol for open angle glaucoma, and just pay attention that all of these have the ending LOL, which is common for beta blockers. We have Timolol, which is for open angle glaucoma. Carbonic anhydrase inhibitors inhibit the enzyme carbonic anhydrase, therefore decreasing aqueous humor formation. Directly applying these medications to the eye reduces the IOP in patients with chronic open angle glaucoma. Doctors also prescribe carbonic anhydrase inhibitors in closed angle glaucoma for a short duration to lower IOP and perform surgery. Patients can apply carbonic anhydrase inhibitors locally to the eye or use them systemically. So we have the medication Trusat, which is used for glaucoma. Cholinergic agents, miotics, they resemble carbonic anhydrase inhibitors in their effectiveness in certain glaucoma types. The medications reduce IOP by contracting the ciliary muscle, thus increasing the outflow of aqueous humor. So we have pilocarpine for glaucoma. The name sympathiomimetic refers to mimicking or acting like the sympathetic system. Most agents work for patients with allergy eyes. It reduces IOP by reducing aqueous humor production and increasing its outflow. These medications treat open angle glaucoma and in conjunction with other glaucoma medications to reduce IOP. So we have alpha-Gen P for open angle glaucoma. Prostaglandin analogs. Several agents are prostaglandin analogs. They include latanoprost, betamiprost, and travoprost, and they reduce IOP by increasing aqueous humor outflow. So you can see they all have the ending of prost for prostaglandin analogs. And I talked about Zalatan before. It is a very popular, common medication prescribed for open angle glaucoma. We have Lumigan for open angle glaucoma. There is a new betamiprost formulation, which is called Latisse. You might have seen commercials for it before. It can thicken eyelashes, and it is for eyelid hypotrichosis, which is less than a normal amount of hair. Over-the-counter agents like artificial tears help people with dry eyes. It's a very common condition. A severe dry eye medication is Restasis for prescription, but most of them are over the counter. Restasis alleviates chronic dry eyes caused by inflammation. The human ear is responsible for hearing, balance, and equilibrium. The ear contains 3 major sections: the external, middle, and inner ear. The most exterior part is the auricle. This area has cartilage and skin and serves as an entrance for sound waves. The auricle transmits sound waves through the external auditory canal. The canal leads to the tympanic membrane, which is the eardrum inside the ear. The tympanic membrane has two major functions: transmission of sound waves to the middle ear and protection of the middle ear from foreign objects. Sound transmission happens because of vibration, much the same way a drum skin vibrates and carries sound when struck with a drumstick. Glands inside the ear produce cerumen, which is earwax, a waxy substance. Vibrations from the tympanic membrane extend to the middle ear. The middle ear has three very small bony structures called the auditory ossicles. So there is the malleus, the incus, and the stapes. These three small bones connect to each other and transmit sound waves that make it to the eardrum. Another middle ear area is the eustachian tube that leads to the nasopharynx. When a person swallows, yawns, or moves the jaw, the eustachian tube opens and relieves pressure change between the outside and inside atmosphere. And just a tech note, when a person in a car or plane ascends, the eustachian tube relieves the decreased pressure from the outside by causing an ear pop, and this equalizes the tube pressure levels. After sound transmission through the ossicles, the stapes continues to transfer into the third ear section, the inner ear. We have three main areas of the inner ear and their functions: the cochlea, the vestibule, and the semicircular canals. Various conditions affecting hearing quality include infection, swimmer's ear, earwax accumulation, damage to the eardrum, and congenital anatomic defects. Antibiotics are ineffective against viral ear infections. Depending on the bacterial strain, physicians can prescribe bactericidal or bacteriostatic medication. Bactericidal agents kill the bacteria, and bacteriostatic agents limit bacterial growth. Bacteriostatic drugs help the body's immune system to fight off bacteria. So we have table 26.5, which lists select products for the treatment of conditions for the ear. We have medication used to remove earwax and medication used for external ear infections and prophylaxis of swimmer's ear. Otitis media is a middle ear infection and often occurs within the eustachian tube. Otitis media is a common ear infection treated clinically. It causes changes to the eardrum that include bulging, swelling, and perforation. Anti-infectives can treat the infection. However, children with frequent recurrent infections may need small tubes inserted through their tympanic membrane to allow drainage from the middle ear and eustachian tube. This reduces reinfection. Common otitis media symptoms include fever, nausea, and vomiting, earache, hearing problems, and inner ear pressure. When children tug at their ear, this is a classic sign that they may have an ear infection. So we have common agents for the treatment of otitis media in children. The glands near the tympanic membrane produce a waxy substance called cerumen. The cerumen acts as an infection barrier. As the amount of wax increases, it migrates out of the ear. If excessive wax accumulated, it is not removed or dries, it can impair hearing. A physician may need to remove waxy buildup to perform an examination or improve hearing quality. So we have the medication carbamide peroxide, which is available in a bunch of different trade names, and that is used for earwax removal. Certain medications can cause temporary or permanent hearing loss, known as ototoxicity. This injury can present as an ear ringing or buzzing, which is tinnitus, and can progress to permanent damage if untreated, and it affects balance. Aminoglycosides in high doses for extended periods are notable for ototoxicity. Health professionals assess patients who take these medications daily to ensure therapeutic outcomes without toxicity. So box 26.3 lists several medications that are associated with tinnitus or ototoxicity. So here's the class and here's the specific drugs. The upper respiratory system contains the nose and nasal cavities, the pharynx and the larynx. The nose and sinuses play several physiological roles. The nasal septum separates the interior of the nose into two distinct cavities, lined by a mucous membrane with microscopic hair-like cilia. The mucous membrane warms and moistens inhaled air before it passes to the lungs, and the nose is also a sensory organ for smell and acts to drain tears from the eye. Because the nose and sinuses contact the outside world, allergens can result in allergy symptoms or infections. Allergic rhinitis is an irritation and inflammation of the mucous membrane lining the nasal passage secondary to allergen exposure. Common symptoms include runny and itchy nose, sneezing, congestion, and postnasal drip. Postnasal drip occurs from accumulation of mucus in the back of the nose and throat. OTC products can help relieve these symptoms. So here's select over-the-counter products. These are for treating allergies. We have Flonase, a nasal spray for allergic rhinitis. Acute bacterial sinusitis is a sinus infection and corresponding inflammation of the nose and nasal passages. Symptoms are nasal congestion, nasal discharge, cough, sinus pressure, headache, and fever. Individuals who use saline irrigations to treat sinusitis should use sterile or bottled water to prepare the saline rinse. Some have contracted amoebic encephalitis from tap water rinses. The medication Augment or Augment XR is the generic name is amoxicillin plus clavulanate, and it's indicated for sinusitis, urinary tract infection, and other miscellaneous bacterial infections. The throat is composed of the pharynx and larynx. It is the passageway into both the respiratory and the gastrointestinal tracts. Streptococcal, I'm not even trying to say that name, strep throat, is a bacterial throat infection associated with an abrupt onset of throat pain, fever, and exudate from the tonsils. The goals of antibiotic treatment are to reduce the duration and severity of symptoms, incidence of complications, so like rheumatic fever, transmission of the bacteria to close contacts. We have the medication, just regular amoxicillin, which is indicated for bacterial pharyngitis, bacterial tonsillitis, and other miscellaneous bacterial infections. As with any antibiotic, we should be taking them until they're gone. And that's a huge thing for many, many people. They get their antibiotics, they take them for the first 5 days, they feel fine, so they don't take them for the last 2 days. That can introduce reinfection and bacterial resistance. We also have the medication Zithromax, which you might know from a Z-Pak. It is indicated for bacterial pharyngitis, bacterial tonsillitis, and also miscellaneous bacterial infections. That is another take until gone, as with all antibiotics. GERD can occur when the upper sphincter opening at the top of the stomach relaxes. This allows acidic stomach contents to back into the esophagus. Bare esophagus is a disorder in which the lining of the esophagus is damaged by stomach acid. The medications used to treat that used to be ranitidine, and that medication has now been removed from the market. But we have omeprazole, lansoprazole, and then, of course, we have their following sound alike, look alike drugs just to keep in mind. We have Tempotic versus Verooptic, Tobrex versus Tobradex, prednisone versus prednisolone, and Carvedilol versus carvedilol.